Hi, my name is Dr. Jeffrey Hamm. I'm a board-certified surgeon for the last 36 years. Patients who are good candidates for face and neck lift have to have some facial laxity, either laxity of the skin and/or laxity of the underlying muscle. They may have some excess fat to remove as well. So it's a layered repair. It's a V-shaped vector of the cheek and neck. It goes from the cheekbones down to the bottom of the neck. Usually some liposuction is performed on the neck, but basically it's a layered repair where we go underneath the skin of the neck and tighten up the muscle layers that have fallen down separately, and then we tighten the skin over the whole thing. So we get quite a lot of skin out of the neck because the vector incision is hidden behind the ears in the hairline. On the cheeks, we don't want to pull the cheeks too tightly and have any distortion of the mouth. But still, we can get a significant portion of excess tissue removed from the cheek without any distortion of the mouth. So it's a face and neck lift in a multi-layered repair, including tightening of the muscle, so-called plication of the platysma muscle, as it's called. During a consultation for a face and neck lift, the patient's overall medical condition is reviewed. You don't necessarily have to be elderly in order to be a candidate for this surgery. If you've had a major weight loss, for example, a lot of people can be improved by having a face and neck lift following major weight loss. During a face and neck lift, the patient is generally put to sleep under general anesthesia, so we have complete control of the airway, breathing, and circulation. Then the face is infiltrated with local anesthetic with epinephrine, and this is allowed to take effect to reduce any bruising and swelling and bleeding during the operation. The incisions are made in front and behind the ear and hidden as well as it can be, and the skin is lifted off of the underlying muscle tissue. The underlying muscle tissue on the cheeks and neck is then tightened separately in a separate layer, and then the skin is tightened over the whole underlying tightening. Recovery from a facelift is usually quite easy. The patient is wrapped in sort of a turban overnight or over 2 nights, and then it's removed. I put my patients in the shower once the dressing is removed so they can wash any blood or prepping material out of the hair and off of the face. So the idea is to keep everything as clean as possible. Many of the sutures are removed after 6 or 7 days. The rest of the sutures are removed about 12 to 14 days. The results of a facelift are very subjective. Obviously, it's a tightening procedure, but it's not an over-tightening procedure. I'm sure everybody has seen pictures on the tabloids of well-known actors or actresses who have had an unfortunate experience with a surgery, and the idea is not to look like you've had surgery, not to look like you've had a facelift. I would not want patients to say, "Who did your facelift?" I'd like them to say, "Gee, did you lose some weight, or are you just back from a vacation, or you look rested?" Something they can't quite put their finger on, but they know that something is improved.